Hi, this is Paul Slatkus, Good News Planet. I'm speaking to Dr. Dudley Seth. Hi, doctor. How are you?
Hi, Paul. How are you?
Okay, good. President and founder of the Cedars-Sinai Tower Urology Medical Group in Los Angeles, and a heck of a lot of other great involvements, and a do-gooder. And he's written a very interesting book, Penis Power, The Ultimate Guide to Male Sexual Health. And, of course, everybody who sees that name of your book says, what? I imagine. And so, and I'd like to say that you start this book to my father, a man of true penis power. Well, he's got 20, many kids? Why do you say that?
Well, because he was a man of positive thinking, often wrong, but never in doubt, a man that always stood tall. He sent me in the right direction, gave me a lot of good attributes about life, power of positive thinking. So he was just one heck of a guy. So the term penis power is kind of a generic term. I'm a mainstream urologic surgeon here in Cedars-Sinai in Los Angeles. And I want to remind everybody, that penis is not a pejorative word. It's a body part, like an elbow to an orthopedist or a heart to a cardiologist. The penis is the bread and butter of urology. So get over it.
Now, doctor, someone told me a joke. I thought I would share it with you. Okay? And I respect you're really a urologist and a doctor and so on. A little boy comes out of the shower. I just heard it last night. A little boy comes out of the shower and he's holding his testicles and penis over there. And he says to his mother, "Are these my brains?" And the mother says, "Not yet."
Yeah, that's a good one. It's very hard to tell a urologic joke to a urologist. We've heard them all because the examination is very awkward, and almost all of the patients, they come into the examining room, they want to put the situation at ease. Hey, Dr. Danoff, did you hear this one? So I've heard every genital penis joke ever invented, but that's a good one, and very true.
All right, and it's true because of why?
Well, we're all little boys, when it comes to our penises. When we're hard, we're soft, and when we're soft, we're hard. And any smart woman knows that when a man has an erection, all the blood rushes from his brain to his organ, and he's like a piece of putty.
All right.
Unfortunately. Or fortunately, I'm not sure.
It says here, did you know that 99% of male dysfunction now occurs from between the ears, the home of the brain, while a mere 1% of problems are physical limitations caused by organic reasons, medications, or surgeries, according to you. Is this so?
Yeah, well, we're not talking about older men who have hypertension and hyperlipidemia and diabetes and are overweight, but in the vast majority of younger men who are complaining of erectile dysfunction, ED, absolutely, 99% between the ears and 1% between the legs. It's all about confidence. It's all about not allowing self-doubt to introduce itself to the bedroom. Self-doubt, anger, fear, all of those are like that dog that was chasing his tail around in ever-decreasing circles until he disappeared up you-know-what. So no negative thoughts. That's an absolutely true statement.
So can it also, in this regard, are we talking going to be the partner, not...
Absolutely. I mean, if there's anger from the partner, if there's distractions from the partner, if there's a failure of emotional honesty from the partner, all of that will directly impact on a man's ability to get an erection.
All right, let's go to the book here, Penis Power, The Ultimate Guide to Male Sexual Health. How'd you break this very important subject down?
Well, again, I am a urologist, and I wrote this book to try to cover all of the subjects of male sexual health. I also try to introduce some humor. So I talk about prostate cancer. I talk about sexually transmitted disease. I talk about robotic surgery, testosterone replacement therapy, Cialis, Levitra, Viagra, penile prostheses. You name it, I talk about it. I even have a chapter specifically written for women. I want every woman to be a penis professor about the man in her life. So
you want the
I try
women
to
know
cover the
about
full
penis.
gamut.
Okay. Well, that's it's a two-way street, right?
Oh, absolutely,
in most
absolutely.
cases.
I am not a male chauvinist, but the more giving, the more one gets. The more you give away of your heart, your soul, your emotion, the more you're going to get back in all of those areas, and then some.
If you overuse it, will you lose it?
Well, I have, when I started in practice, I rarely ever saw a 100-year-old man, and now I see maybe one a week. So there's no question that we're living longer, we're living healthier lives, and if you're physically fit and mentally alert, there's no reason why you can't have sex until the last day of your life, and you got to use it or you're going to lose it.
Okay. Is there a point that a man could not, have a child? Is there only so much sperm in a man's body?
No, you're not allotted by the Lord a limited number of ejaculations. I mean, it depends on the man. As you age, your sperm count will go down. The volume of your ejaculate will decrease. But it only takes one good swimmer. So, there are men in their 70s and their 80s who conceivably can impregnate a woman. But as a general rule, as a man gets older, the volume of the ejaculate decreases and the absolute number of sperm decreases. So it does become more difficult.
Is there something that a man can do to increase that?
Well, I think genital health has to do with general health. So I think you have to have a physical fitness program, a good cardiovascular program. You got to watch your weight. If you're a diabetic, it's got to be treated. If you're a hypertensive, it's got to be treated. If you have hyperlipidemia, you got to control your cholesterol. So physical fitness leads to sexual fitness.
What is BHP?
BPH?
BPH, I'm sorry.
Oh, yeah. So that stands for benign prostatic hyperplasia. It's just a way of saying as a man gets older, his prostate becomes bigger. So benign, meaning not malignant, prostatic, meaning of the prostate, hypertrophy, enlargement. So BPH is really a benign enlargement of the prostate, and that happens almost in all men as they age.
And is that an indication that you might have a prostate problem? Do they work?
Well, I mean, if you're getting up at night, if you have a thin and narrow urinary stream, you have incomplete bladder emptying, all of those things indicate prostatic enlargement, and there are very, very good medical treatments for that, and the man, if he has those symptoms, should be seeing his urologist.
Is there something a man could be actually helping cause prostate cancer in their body at a younger age?
Yeah, prostate cancer. We're going to see 240,000 new cases of prostate cancer diagnosed in the United States this year alone. You can't do anything to prevent it. If you're African American, if you have a family member, a male family member with prostate cancer, you're 30% more likely to get it. So it's a silent disease. You've got to go to get your digital rectal exam, your annual PSA. So that if you do have a prostate cancer, it can be diagnosed at an early and curable stage, but it's a silent disease. So
what kind of a checkup does somebody get, and what time and what year do they start doing that?
We say at age 40, unless, as I say, you have a male member of your family with a history of prostate cancer, or if you are an African American, and then age 35. And it requires an examination of the prostate, perhaps an ultrasound, and a screening blood test, quite easy to do, not very expensive, and should be done by every male.
Okay. How would you banish stress from a bedroom?
Well, that's all about psychodynamics. So I think if you have stress in the workplace, or if you're angry driving home on the Belt Parkway in Brooklyn or on the 405 freeway here in Los Angeles, you got to put that in a little box, and you got to put that box outside the bedroom door. Because if you don't banish stress, your erections will be the victim.
Is there anything sexually that people can do to excite somebody that you think is better than others and more effective?
Well, I mean, look, it's all about your partner. So if you have a loving, sharing, sexy, erotic partner, who supports whatever it is that you personally need, you're going to have a more sexually fulfilling life. So it's a very individual thing. What goes on behind locked doors by two consenting adults, as long as it's not unsafe sex, there are no holes barred. Holes meaning HOLDS. So the difference between, as we say, the difference between professional wrestling and making love is that in making love there are no HOLDS barred.
Is there, I probably could talk to you for a lot longer. You got a wonderful book here. Is there any other things you'd like to share with us in the audience right now?
Well, I mean, go to my website, www.penispowerbook.com. There's a lot of stuff on it. I blog and tweet and on Facebook, and there's a lot of good stuff there for your listeners to participate in. They can always call me directly at Cedars-Sinai Medical Center in Los Angeles, and I'd be happy to speak with them personally.
What a good man. All right. You're a good guy.
Well, thank you,
Dudley.
So, where in Brooklyn are you, Paul?
Oh, we're downtown near Brooklyn Academy of Music, or now the Barclays Center over here.
Yeah, I know that area very well. So
I'm going to go down to Junior's and have an egg cream very soon.
There you go. Unfortunately, we don't have anything like that on Wilshire Boulevard.
We used to have Factors. Factors, wasn't it called?
Yeah, it's still around. It's still around. Yeah.
And there's another place also that was the one.
Nate and Al's is another famous hangout. Larry King and all those people.
Yeah, my buddy owned one. Gary Greenbaum. His family had a deli out that way as well. I used to manage Television City in my younger days at next to the Farmers Market.
Oh, yeah, I know where that is, absolutely. That place has grown dramatically. You probably wouldn't recognize it.
No, I know it has. I come out all the time. I come to L.A. a lot. So. Well,
good. Next time you come, let's have lunch or do something, as they say in Hollywood. Let's have lunch together.
Our versa versa. We can have lunch here too in New York.
Absolutely.
As well. I think you have a lot of good stuff here. I'd love to talk about making a TV series. I don't know if you've ever addressed that. But
I mean, I'm open to all suggestions. I'm a busy practitioner, but I have a lot of energy and a lot of good ideas. And I do a lot of radio. I do television. So book signings, everybody seems to love it. So I'd be more than happy to entertain something like that, just as long as it fits into the schedule and makes sense. So I'm as the kids say, I'm down for that.
All right, I'll send you something. We're doing a very big outreach on September 21st for World Peace. It's Peace Day.
Oh, great!
Worldwide.
Well, there's the old saying, make love, not war. I'm all for world peace.
So let me ask last question then. What's good news for you?
What's good news for me? I have a new grandchild, so that's pretty good news. So I at least know the name goes on.
There you go.
And I'm happy to be doing what I'm doing and sharing a little of my knowledge about male sexual health with everybody in America and around the world. And I'm happy that I can communicate a positive message.